Lorna, over to you.
Hello, everybody. Good afternoon, and welcome to our weekly COVID-19 media briefing with Montgomery County Executive Marc Elrich, Health Officer Dr. Travis Scales, Dr. Earl Stoddard, who is the Director of our Office of Emergency Management and Homeland Security. I'm Lorna Vigili, Hispanic Public Information Officer for Montgomery County Government. Good afternoon, members of the media. All of you should already have permission to record. If you do not, please request it on the chat. And with that, let's get started, Mr. County Executive.
So good afternoon, everybody. And I think we all know we're about 1 week away from the sad anniversary, 1-year anniversary of COVID making its appearance in the county, starting with 3 people who took a trip up the Nile River and came back here. And here we are pretty much a year later and still very much in the midst of this. So I want to provide an update, and I'm going to start by talking about a couple of things that I know we get a lot of questions about. People, I think, seem to think that the county has control over the number of doses we get, that if we wanted more doses, we could get more doses. And so I sort of make a couple of things clear. Again, the county does not control the quantity of doses we receive at our local health department or at the hospitals or pharmacies within the county. These are all state decisions. Similarly, the state doesn't control what doses it gets. It's been getting an allocation that comes from the federal government. And that allocation, as we know, and we learned in stories that happened right after the transition to the Biden administration, that doses that people thought existed actually did not exist. And it's created, an ongoing, I'd say, headache and problem in getting doses out. But the doses we receive are the doses that the state allocates to us. The companies that produce doses have an obligation to sell their supply to the federal government because they're a part of Project Warp Speed. So we don't have an independent avenue toward getting doses. So that is the dose situation. The second big problem we face is scheduling. And if any members of the public are listening in, I know all too well how painful the scheduling process has been. But I, again, want to explain how the scheduling process works. The county has a pre-registration system. We pre-register people for doses when we know what doses we're going to have. Until this week, we did not know how many doses for sure we were going to get in the coming weeks. Now we've been told that we'll be getting 4,500 doses ongoing for 3 or 4 weeks, and we can plan for that now and do some advanced scheduling. Until this week, we didn't have that knowledge in order to do advanced scheduling with, and the same is true for the pharmacies and the hospitals in the county, and in fact in the state. And if you don't know what you're getting next week, and 2 weeks from now, and 3 weeks from now, it's impossible to schedule people. So we've only been able to schedule people about a week at a time. That's number one. Number two, the county has no control over scheduling. The state requires the county, for its 4,500 doses, to actually go through the state prep mod system to have the scheduling done. We're not allowed even to have our own scheduling system, which we have raised as an issue and said we could create one and create a better one than what the state has running. The state has not allowed us to do this. But worse than that is the situation with all the other providers. Every provider, whether it's a pharmacy or hospital, gets their doses from the state. The state has allowed everybody to have their own scheduling. The state has not provided a single point of registration and a single point of registering, and simply left it to every provider to be on their own and figure out their own scheduling system. So there is not a single site. I get so many emails and texts about, why don't you have a single site for sign up? Why don't you have a single site for registration? I convey that message back to the state. They have yet to agree to create a single site for sign up or a single site for registration. So until that changes, every pharmacy, every hospital will be doing their own scheduling. And some of them have very few doses of vaccine, particularly the pharmacies, you should not be surprised to see those doses gone very, very quickly. I wish I could change it. Again, we've said that we could, create a scheduling system if the other partners were required to work with us. We could create a system that would work for everybody, but in the absence of the state doing it, or giving us permission to get somebody to do it, we are stuck with multiple different scheduling systems. Again, I'd love to change this. I cannot change it right now. The local health departments received about 4,500 first doses per week for the last couple of weeks. And as I said earlier, we expect that to be maintained for the next 3 or 4 weeks. So far, nearly 134,000 residents in Montgomery County have received their first dose, which is the most in the state, and over 55,000 residents have received their second dose. More than 12% of Montgomery County residents have received their first dose, and 5% have been fully vaccinated. Based on the data provided by the state, nearly 60% of the estimated 73,000 Montgomery County residents who are older than 75 have received their first dose of the vaccines. And over 27% of residents between the ages of 65 and 74, have received their first doses from hospitals and pharmacies. Our health department is still focused on vaccinating people 75 and up. However, based on the numbers that we're seeing now, it is highly likely that our county will soon start running vaccination clinics that will vaccinate people between 65 and 74, and hopefully along with that, frontline workers. That's not going to happen this week, but we think as we begin to draw toward the end of the senior pool, that we're immediately going to turn our doses to the broader population. The county continues to lead the state in the number of residents who have received their first and second doses through county-run clinics. And I'm really proud of the work that our clinics have done. Outside of that horrible glitch week ago or so, when so many people got invitations to register for vaccines who were not supposed to get invitations to register, that seems to have calmed down. I'm hoping that more people are realizing that sending out links to their friends and family and people who aren't eligible was really disruptive to the process, and it didn't do anybody any good. Since if you weren't 75 or older, we turned you away anyway. So it didn't serve to do anything, and we really need to be able to manage the scheduling of doses so that people who need them most can get them. If you look at county data, you'll see why we've been doing this. The highest number of deaths in terms of both absolute number and deaths per 100,000 are in the senior groups. And the group of people age 60 and older comprise the vast majority of deaths in Montgomery County. That's why they were prioritized to go first. That's why we're focusing on the oldest of those groups, which has the highest percentage of people who are likely to die from getting COVID. This is a public health first perspective. It's not first come, first serve. It is trying to make sure that the doses go to the people who are most vulnerable. In the same way, we've been emphasizing our efforts to bring vaccines into our diverse communities. African Americans and Latinos are being vaccinated well below the rate of other people. We understand that there are longstanding historical reasons, particularly in the African American community, regarding their assessment of who the health system takes care of and the quality of care they've received historically. There are language issues with people. There are technology issues. Not everybody has computers. We have people who are going to work in the morning because that's what their jobs require. And so the vaccine sites, vaccine reservations are taken up in many cases outside of the county within minutes of opening up a site for registration. This last Sunday, we opened the site in the East County at the East County Recreation facility. We vaccinated 546 people on Sunday, including Harvey Ziegler, a 100-year-old African-American resident of Montgomery County. I've known Harvey for years and years, and he came down from the Damascus area to get his vaccine here. We are trying to demonstrate how important it is for the Black community to get vaccinated. I know that there are ample reasons for people to have concerns about the American health system. Who, when they do testing, who are their trials based on? There are historical examples of the misuse of medicine in the Black community. We know all that. But the important thing in this moment is this vaccine is safe. This vaccine will protect you from COVID. The effects of COVID are far worse than any of the side effects that have really come out of the vaccine. So we think it's important that everybody get vaccinated and that people focus on the value that this vaccine will bring and the fact that it will extend the lives for people who otherwise might perish if they catch COVID-19. Our cases of COVID have consistently been trending down. And although our numbers are encouraging, we're not comfortable yet. And, we get a lot of people, again, who write in and say, look how good your numbers are. Your numbers are really good. You're going in the right direction. Yes, we're going in the right direction. We're still higher than we were this summer. We're higher than we were this summer when we would not open things because the numbers were too high. Those numbers are still too high. They're just better than they were at the peak of the second wave. We are confident that we're moving in the right direction. I think all of us believe that the caution we've taken in opening things has aided the county in having this rapid decline. If you go to charts that compare the county in terms of positivity in cases per 100,000, you get a good idea of how the county is doing, particularly compared to other large counties. We are doing fairly well. We want to also emphasize testing. It's one of the strategies that we focused on through the pandemic, and it's actually the best way to find out who has the virus. That is important for the usual reasons, which is we've been trying to identify where the cases are so we can focus efforts in the hardest hit communities and bring the spread of the virus down now that we've got a vaccine. But now they're extra important because there are at least two variants that are present in Maryland, the South African variant and the British variant. Both of them appear to be more transmissive. The British variant appears to be more lethal, and we need to know where it is and how prevalent it is in the community. So the state is working with us and all the counties in the state, all the jurisdictions in the state, to sample all of the tests to try to see if we are whether the British and South African variants are showing up and to what degree they're showing up. We don't yet know what that could mean for our residents, but it is something that gives us some hesitation because it has been suggested that one or both of these variants could become the dominant strain in the community in the not too distant future. And it would not be prudent to open things up and discover that now we're dealing with a more transmissive virus and we're dealing with a more lethal virus. So we're trying to measure what we do against the unknown, which probably won't be unknown for very long, about what the impact of the new strains are. We've got a long way to go to get the supply of vaccine up. It's still not nearly close to meeting the demand. The supply coming to the county has been relatively stable. It's under 15,000. The county's 4,500. The other 10,000 or so, more or less, has been going to the hospitals and pharmacies, none of which have had a steady supply. But we really need more vaccine. And this is the place where there's actually some pretty positive news. Pfizer and Moderna have said they're ramping up production possibly 2 to 3 times as much. And this is not a long-term project now. This is a project that'll be coming to fruition fairly soon. So those doses should be reaching the state pretty soon and hopefully reaching the county soon. As of today, Johnson & Johnson was found safe and effective by the FDA, and they already have produced doses. So as soon as they're given the go-ahead, those doses should start flowing to the state. And once they hit the state, they'll be coming out to the counties. And these are single doses. They don't require a follow-up shot right now. They are just, they're effective at a single dose level. So we're encouraged that this should happen soon. It will be critical because once we get these doses, we will be able to increase the rate of vaccinations. The county has been doing and can do about 2,000 vaccinations a day. We can go higher than that if we have the supply. So we're prepared to do more. We know our hospital partners are prepared to do more. We just need the supply to show up. And as soon as the supply shows up, it's going to be in the arms of our county residents. We need more vaccine to distribute in the county, and there's been a lot of talk about a mass vaccination site. A lot of us are troubled that the most populous county in the state with the highest number of cases does not have a mass vaccination site. And the state's idea is that the site of Six Flags in Prince George's County is meant to be a bi-county site for county residents and Prince George's County residents. And while county residents have taken up a lot of the appointments of that site is far and away removed from most of Montgomery County. And for people who don't have a car, they're just flat out of luck. And so it's nice to provide additional doses, but if the doses require people to have good technology and automobiles to get around in, it's really going to leave a lot of people out of the picture. The county has multiple options for a mass vaccination site. We've talked to the folks who run the fairgrounds, and they're willing to let us use this. And I talked with WMATA yesterday, and WMATA said that we could use their stations for some of this vaccination, since obviously mass transit and commuting has been down a little bit due to COVID. So we've got options for putting in a site. If a site's in Montgomery County on the west side of the county, that could also serve Frederick, which also doesn't have a mass vaccination site. But we're prepared to do this. The only caveat is it would not be helpful if the doses that go to a mass vaccination site come out of the supply we're already getting. If the county's putting out 4,500 doses and we're focused on the seniors, and we are still the only group in the county that is singularly focused on the seniors over 75, if mass vac sites take those doses from the county, then this is just going to delay the vaccination of the most vulnerable people in the county. So we want the site, but this ought to come from fresh supply that the state is getting. If they did that, the county would seriously be able to ramp up the number of people that we're vaccinating. We look forward to partnering with the state on this. And I will wait for more questions and turn this over to Dr. Gales.
Good afternoon, everyone, and happy Wednesday. I will make my remarks brief to save time for questions, but wanted to emphasize a couple of things the county executive mentioned. While we have seen improvements in our community transmission levels, we still are waiting to see the impact of variant strains that are present within our community. The state has undergone or started a surveillance testing program to get a sense of what the true prevalence or an estimate of the prevalence of those variant strains are within our community. That is going to take some time before we get, a matter of at least a couple of weeks to get more information. We will utilize that information to help guide the guidance that we provide to the CE and others to help inform the process of determining what aspects and how we move forward in terms of reopening things. We do understand that folks are seeing the numbers and improving, but I also want to emphasize that there's a difference between improving numbers and containment numbers. Containment means we've got things at a low level of transmission that we can feel comfortable that reopening things here and there won't cause a significant rebound in cases. And given that we do know that the variant strains are here, we know that they're higher in terms of being contagious than the novel strain, we are taking a cautious approach in terms of doing that so that we don't again introduce a rebound and see our cases pop up more. We do anticipate that we will continue to get requests about activity X and how can we change this and when are we going to move forward with that. But I want to level set your expectations in terms of what's going on in our thought process and how that will determine how we move forward. We will continue to work with our regional partners as well to make sure that we are on the same page as best as possible, consistent with the approach that we took back during the summertime when we were discussing reopening aspects of society then. The second thing I'd like to emphasize is I don't always get a chance to regularly go through all of the mail that comes to my office, but I did have a batch of mail delivered today, and I received a note from a Greencastle Elementary first grade class, Mrs. McGrath's class. And they wanted to advocate that we provide more masks and gloves for homeless people and make sure that we have hand sanitizer in our grocery stores and parks. And I want to acknowledge that I received your letter, and I will make sure that the team addresses that. And thank you for being advocates for others within your community. And the hope is that all of us remember the spirit of community and collaboration as we continue to move forward in making our way through the pandemic. I also want to lastly say, I did say this was going to be brief. I wanted to lastly say a special thank you to the continued efforts of all of the members of our government agencies, from public health and health and human services and emergency management and other aspects of government who've continued to stand up and support the vaccine efforts that have been in place, including those additional ones that we launched last weekend. And we are excited to continue to move forward to explore other partnerships with our community partners to stand up new opportunities to continue to make sure that our distribution process is fair and equitable. Thank you.
All right, I just have a few comments, so we can get to questions pretty quickly here. As the county executive alluded to, we are obviously planning for the next tiers over the next few weeks, obviously 65 to 74, but also our essential workers. And amongst essential workers in our phase 1B tiers 2 and 3 include grocery store workers, postal workers, transit workers, our educators and education staff. Obviously, those are being addressed through the Hopkins partnership as well. Our child care providers, which we've already started on in small amounts, but expect to expand into considerably, and our food access providers. So we've already begun collecting lists for many of our food access providers this week. Additionally, we'll be working with some of the other nonprofits to do very front-facing, close to individuals' work. We have our lists already from our nonprofits, our non-public schools, and we have MCPS has provided their list as well. And so we're continuing to work through those lists. We have our transit list, transit worker list as well. We're going to work through all of those and try and identify exactly the priority targets within the groups, those who have the highest contact with the public. And obviously, we'll be utilizing those lists to fuel clinics once we move beyond our 75 and older population. And we'll be doing that concurrently with our working through our 65 to 74 population. I say all this to say, and to continue to reiterate, we believe there are at least 90,000 persons between 65 and 74. We believe that we vaccinated, the collective system has vaccinated about 25% of those already. But we know that there are also probably 100,000 or so essential workers as well. And so this next grouping that we are moving into will be very large. And so just because you are part of that next grouping does not mean there will be a vaccine available for you the first day that we begin vaccinating in those new tiers. And I want to make sure that we set that expectation from the beginning. It will take us many weeks, as it has for the 75 plus population, even with increased doses available from the state, to get through those groups. And so just because we move into a new tier over the next few weeks does not mean that you will instantly get vaccinated, nor does it mean if you're in one of the earlier tiers as a healthcare worker or someone over the age of 75 that there will not also be a vaccine available for you as well if you decide in the future that you would like to vaccinate. That's all I wanted to say today, and I think we'll be happy to take some questions.
All right, thank you, gentlemen. Let's get started with the questions. And first in line here is Kate Ryan, WTOP, with questions for Dr. Gales and also the county executive. Kate.
There we go. Thank you very much. Two questions for you on the fix for PrEP mod. You guys have talked about this again in order to prevent the use of someone's sign-in. I know the state has said they are working with PrEP mod to get a fix so that I can't use your sign-in or my neighbor can't use your sign-in. Have they gotten back to you on how soon that might take effect?
I can answer that quickly, Kate. I think you might be reading my email because I just received an email about an hour ago that says the state is intending to go live with that change starting on this Friday. So that is, you have a timely question. I'm glad I'm able to provide you with a response.
Okay, that's great. And then in terms of, I understand that Johnson & Johnson, you don't know yet how soon that might add to what you get. Is that correct?
Well, yes. So we know that it's moving through the approval process, but the state has not communicated to us yet in terms of what that would look like. I know they have been working on it. Don't get me wrong. I know they've been working on it. They brought it up in previous meetings, but we don't yet have the official details in terms of what the allotment would be from the federal level to the state level, and then how those doses will be prioritized to the jurisdictions from a distribution perspective, as well as if there will be any additional recommendations in terms of who those doses will be prioritized for or best suited for administration.
Okay, and then the last follow-up, I want to make sure I'm absolutely clear on this. I know that, and yesterday in the council meeting, there were repeated pressings for, boy, we could really use this mass vaccination site here. There was a mention that, again, County Executive, I know you said, look, we have sites that could be used. How close are you to actually getting the governor to agree to have a mass vaccination site here?
Anybody wants to answer that question?
Yeah, anyone want to take that one?
Well, I can't comment in terms of how close, but what I will say, what information I have, is that the state plans on standing up 3 additional mass vac sites in other parts of the state. I believe 1 in Southern Maryland and 2 in Eastern Shore area. And they will go back, and after those have been stood up, reevaluate to see if or make a determination to see if any other sites will be stood up. That's my understanding. Unfortunately, I don't have a timeline associated with that.
But there's no commitment, still no commitment to Montgomery County.
That is correct.
Yeah, the state continues to say that they're focused on their next 3, which is Dr. Gales alluded to, and then after those total of 6 are stood up, they may assess that whether they need to have additional ones or not. And even if they assess they need more, they're still not committing to doing one in Montgomery County, even should they decide to do a 7th, 8th, or others.
Got it. And final and last question, I promise, is on the mass vaccination single portal. Has the state said who will provide the technology for that single portal? Will it be PrepMod?
I don't think we know. I don't know. I don't think we know.
Gotcha. Thank you very much. I appreciate it.
Okay, the next question comes from Rebecca Tan with the Washington Post, and I believe she has questions for the 3 officials. Rebecca?
Thank you. Dr. Gales, you mentioned sort of a dip in testing recently, and I'm wondering if you can tell us, how much specifically has the rate of testing gone down in Montgomery County, and do you have a sense of, do you have an understanding of why this is happening? And then I have a separate question on restrictions.
I have to, thank you for your question. I have to follow up with you on the specific number. I don't have that in front of me at the time. But I will say the trend that we have seen here is consistent with what has been experienced across the state, and I would argue probably across the nation as well, is that we have seen a dip in testing. I think there are a couple of factors that go into that. One, I think, all of the emphasis has been on vaccination. And I think that has taken up all of the oxygen in the room. And that has prevented us from having larger conversations to remind people that we have an ongoing pandemic. And yes, vaccines are here, and we're working very hard to get as many of those doses out as quickly as we can. But there also are other mitigating factors and features in place that will mitigate transmission. So, the continued public health guidance, and part of that is also including continuing to get tested. We do continue to have capacity to be tested here in the county for those that need. So a reminder, we do have a great system and an infrastructure in place that is in partnership with our community partners. And I think some of it also is, again, I think perhaps the risk perception piece, that when we see the numbers improving and we see vaccines there, I think people take their eye off the ball and get a little bit comfortable with that. And so I know the state is looking into some communication campaign type stuff, and we are doubling back and emphasizing in all of our messaging as well to remind people of the value and importance of testing.
Got
If
it.
I may, if I may,
Oh, sorry.
one other thing I would point out, and this is sort of a national phenomenon, as the numbers start to go down, you see you see less testing. And I think that is not an unsurprising phenomenon, because I think obviously, as Dr. Gale said, people get more complacent, but also at the same time, a lot of what drives people to go get tested is an encounter that concerns them. And so if there's less cases in the community, then there may be less encounters occurring that concern people. And so that may be driving some of the behaviors. So, this is not a Montgomery County issue, this is not a state issue, this is a national issue, where you see, as the numbers in COVID come down and people are hearing less of their neighbors or their friends or their family members testing positive for COVID because they're not having infections. And so they don't get tested as much, and sort of it snowballs from there. And so it's not all negative when you see a reduction in testing. We want to continue to encourage the behavior. We want people to go do it, but the behavior itself necessarily isn't. It does not, a reduction in testing does not mean you're missing more cases. It may just mean that there are less cases to find. It's not a perfect corollary.
Got it. And on restrictions, you've all mentioned that, lifting restrictions is going to be something that you're considering. It's going to come down the line. But can you give, residents a sense of how it would happen when it does? What are some of the things that will be lifted a little bit earlier, and what's going to be further down the line? And that's for all officials.
I think we would realistically take up an approach that we took from the beginning, an approach we looked at in terms of identifying activities that would carry high risk based upon the type of activity, the type of interactions in those spaces. We also take a look at, volume and capacity if those activities are influenced by, the number of people participating in those spaces. I think there's a difference between outdoor versus indoor type activities with, air circulation and ventilation, those kinds of things. So I think, again, consistent with the approach that we took back in the summer when we had our first set of reopening activities, we would continue to look at those factors to determine how we would move forward.
One thing we've also talked about is the fact that, and I think I've talked about this a little bit before, I feel like when we went to phase 2, particularly last summer, early June, we probably did too many activities at the same time, and that really crushed our declining numbers. And so what I think we'll do now is be a little bit more, we'll maybe sort of do more frequent but less activities at the same time, meaning, you do a few activities, go 2 weeks, a few activities, go 2 weeks, as opposed to doing, big groupings of activities at the same time and then waiting 6 weeks. Because I think what we've learned is that if we see an increase in our numbers, when you do a big grouping of activities and you put a lot of things together, sometimes you aren't able to, when you see an increase in cases, you're not able to assert which activity that we've done maybe needs some more attention or has some additional concerns associated with it, because you've done it in such a big grouping of other activities, you can't necessarily determine exactly what the activity of concern might be amongst those things. And so I think, we're going to look to be, we've been methodical since the beginning. I think that's been a hallmark of all the conversations we've had over the last year. But I think ultimately, it's going to come down to, the county executive gets to decide in concert with the county council. But certainly our recommendations have been to be more regimented across a period of time, as opposed to doing a whole bunch of things at the same time.
I'll just say, I've been happy to, be able to follow the guidance of our health officials. I don't have a background in health that they do, or in emergency management. And that's why, all the counties in the state have health officers. So I think the input we get is critically important. When I look at activities, there are activities that we know, if you're in rooms and you're unmasked, it just flat out increases the risk of transmission. And so everybody who says you opened up this business that's indoors, and so you ought to open up another business that's indoors. Well, if I'm in a retail store, it's quite possible you could go through your entire retail experience and never once take your mask off, and that you complete your shopping, and probably because if you're like me and other people, you want to be in and out of a closed space as quickly as you can, you have the ability to moderate how much exposure you even potentially get. There are other activities indoors where the masks are off. When you're sitting at tables and you're eating, masks are off. And, you know, people don't put the mask on after every bite. And so there is more prolonged exposure for both people who may not have it and may be exposed to germs that are in the air, or for people who do have it and don't realize it and who could be putting germs into the air or putting the virus into the air. So all things are not the same. You know, just because you're within four walls doesn't mean the activity is the same. If you're engaged in certain sports, you know, tennis is pretty much a non-contact sport. There's little chance that you're going to do something that would result in somebody, you know, losing their mask and exhaling on you directly. There are other sports where the very nature of the sport puts you in contact with people. People get the breath knocked out of them. There's a lot more prospects for contact and spread. So those are the things we're going to look at. We're going to be careful, particularly initially until we see what transpires with the new variants that are here. Hopefully it's not as bad as the worst scenarios have seemed, but reading the reports from England were not terribly encouraging. But we're going to be guided by what we know about the state of the virus at the point we make these decisions. And we're going to make sure that whatever decisions we make continue to minimize the risk that we're going to put people under.
And
Thank you.
I actually, Rebecca, I was able to look up a little bit of the data that we were talking about around testing. The last 2 weeks, we've averaged, and this is the county apparatus, about 5,500 tests over the last couple of weeks. The week that concluded around Christmas, we did just short of 12,000. So that shows you the reduction that we've seen over the last.
Could you repeat that? Sorry, 5,500 and.
Yeah, we've averaged about 5,500 over the last couple of weeks, according to the data provided by Dr. Bridgers. And just the week of the 26th of December, we did 11,831.
Got it. Thank you.
Thank you, Rebecca. Randy Bass with WDVM has questions as well. Randy?
Good afternoon. Thanks so much for taking my questions. I have a few kind of in regards to how vaccinations are counted. I know Montgomery County has said people who live here and or work here are eligible to be vaccinated here. A lot of the healthcare workers in Montgomery County don't necessarily live here. Same goes for teachers. So I'll pose a hypothetical situation to pose my question. If a teacher who lives in Frederick County and works in Montgomery County gets their vaccine here, does that count toward Montgomery County's vaccination totals, or does it count toward Frederick County's vaccination totals?
Randy, it actually counts for both.
Really?
And here's why. So the first way, it depends on the count that you're referencing. I'm not trying to be complex, but it depends on the count. So there's two ways you look at the vaccine numbers. The first one is the number of doses allocated based upon the doses that you receive. So the state, in the state reports that they put out, they say, well, Montgomery County has given out 95% of its first doses. What does that mean? It means that of the doses provided to Montgomery County from the state, whether it's the health department or those different entities, those doses, regardless of who they go to, have been put into someone's arm. So that's one measure to say, we provided you with 100 doses, you physically gave out 98 of them, that's your number. Now, on the flip side, we also look at, for example, Dr. Stoddard has mentioned, the percentage of those who are over 75 who've been vaccinated. That number refers to residents in our county, based upon the Immunet system where it's been reported, who, regardless of where they were vaccinated, who we know based upon their zip code or their home address, that they received that dose. And so that takes into consideration any individuals who may have been, at least in the state of Maryland, who've been vaccinated at another state, another site throughout the state that's not necessarily a part of the doses that were sent directly to Montgomery County or to the health department. And we've been also trying to get a proxy. For example, we know that we had a portion of our residents be vaccinated in DC by virtue of their employment status. And we've been trying to, work with their system to get a proxy of that so that we can factor in, so that we have a better handle of all of the people in our county who've been vaccinated.
Thank you so much for that answer. That really made a difference. Dr. Stoddard, were you going to say something?
Yeah, I was going to say, right now, and this is as of about a week and a half ago, we believe there's been about 10,000 county residents that have been vaccinated in DC, who, because of employment in DC, but live in Montgomery County. And there's been, we've vaccinated several people who are Fairfax County or Northern Virginia residents or DC residents who work in Montgomery County and our sites too. So it works both ways.
Gotcha. So are those 10,000 county residents, are they included in that 125,000 residents that you've said have been vaccinated? Are they part of that total?
They would not be counted in that because that's coming from the state immunity number, which is not shared directly across. That's what we're working on, trying to get those numbers through the Council of Governments. They're actually going to help serve as an interface to share the numbers between Northern Virginia and the district and Maryland, but they're not included at this point. So our numbers are frankly higher than they would be here.
Great, good to know. And that ImmuNet system is also used for mass vaccination sites. So if someone goes to Prince George's County to Six Flags, that number is reflected.
Yep. And we can see how many people at the mass vaccination sites happen to be Montgomery County residents, and that number is actually a fairly high percentage.
Do you know what that number is?
I don't have it in front of me, but I think the update we had from last week was it was about 20% or so of the mass vaccination sites. This is before obviously M&T is opened, where it happened to be between Six Flags and the Convention Center happened to be Montgomery County residents.
And I guess of our percentage of our allotted vaccines, do we know how many of those have gone to non-residents?
I don't have the number in front of me. I do know that when we looked at this number, actually more, and this is going to sound complicated to say, more Montgomery County residents were vaccinated in other counties than other counties' residents happen to be vaccinated in Montgomery County. If that makes sense, what I'm saying.
Yes, that was pretty much the answer I was looking for.
It's very close, like very close, but slightly more have been vaccinated by other counties than we have vaccinated of other counties.
Gotcha.
That doesn't include DC or Northern Virginia or anything like that. That's a more complicated analysis, but we're talking about the state of Maryland only.
Thank you so much. I appreciate those answers.
Thank you. Jordan Lindsay with my NCM has questions for you, Mr. County Executive, and also for Dr. Gales. Jordan?
Thank you so much. Are there any thoughts on MCPS returning to in-person learning starting on Monday? Are the health metrics still moving in a good direction? And I also wanted to combine that question with any updates regarding health metrics when it comes to private schools, since most of them or some of them have been practicing hybrid learning since the fall.
Well, there hasn't been any change to the recommendations that we put forward to MCPS. And again, I would say the metrics that we put forward were consistent with what the State Department of Education put out in August. I know they kind of relaxed and took away metrics in the last few weeks, but the numbers are moving in that direction and are consistent with the guidance that we provided to the schools back earlier in the pandemic. And it's hopeful that, those numbers will continue to stay within those parameters. I think it's also important to note that there are a couple of things that are a little bit different now than where we were back in the fall and late summer. First is that, we do have vaccines on board, and we do know that a significant percentage of those individuals who have been identified by MCPS who will be returning in that first wave have been vaccinated, or at least have had a scheduled appointment to receive at least one of the doses. And we're working behind the scenes to create opportunities for those who will be moving back, who still need an appointment as quickly as we can before they enter back into the school space.
Got it. And any updates on private schools and their health metrics in regards to they've been operating since in a hybrid model since the fall pretty much. And I don't know, did you guys give any advice to MCPS regarding how they've been able to operate?
Well, yeah, so we've continued. We've met regularly with MCPS throughout the pandemic, and we have met on a series multiple times, providing town halls and community conversations with the leadership from non-public schools since probably September. I think was our first conversation And I think we had I think it's been a week and a half ago, the last town hall we did with them on Friday afternoon. And so again, the metrics that we provided in terms of guidance has not changed. And again, let's be clear that due to the state's determination, the schools make their own determinations about whether they open, public or non-public. And we've done our best to provide guidance from a health perspective and a medical perspective, as well as be available to answer their questions to help make sure that, again, if they are open, that they have safe practices in place to try to mitigate transmission as much as possible.
Thank
I
you.
think, Jordan, I think I think one part of your question was, are the non-public schools providing guidance to MCPS? And the short answer to that is yes. They have had a bi-weekly recovery, education recovery work group meeting on the books since middle of last year, basically. I think over the summers we started those up, and they've invited a number of the non-public schools in to present both to MCPS, but also Montgomery College and some of the other education partners as well, to make sure that everyone's gaining from the same knowledge that everyone, based on everyone's experiences.
Great. Thank you so much.
Okay, we have one more question from Brianna Adikusuma, and then Kate Ryan has a follow-up question. Brianna, you first.
Yes, I have two questions, and Dr. Gales, Dr. Stoddard, whoever wants to answer. The first question is, we've received a lot of questions from elderly residents or residents who are homebound. What is the plan to get the vaccine to them? How are they able to get it? What is your kind of game plan for that?
That's an excellent question, and it does highlight a significant need for a very vulnerable population in our community. And we have been discussing that from the very beginning. And in fact, we are working with one of our community partners to try a pilot this weekend, actually. Can't say for sure if it's going to be Friday or Saturday. We're trying to finalize that behind the scenes, where we would test out a mobile platform that would be able to go to and provide some vaccines to homebound seniors who are within their particular practice, and hopefully being able to identify some best practices that would allow us to scale that up and support that effort, as well as potentially set up some others that would be able to provide doses to that population. Now, I just want to level set expectations. It's not easy to do, going home to do that, but we do want to make sure that we do have some provisions in place to provide doses, because everything you said, they are vulnerable and they are in need, and we want to make sure that, consistent with our fair, equitable approach, that they have fair and equitable access to the vaccine as well, since they meet the eligibility criteria.
Right, so presumably in the future, once this pilot program is worked out, residents who receive a link for an appointment will have information as well and to indicate if they're homebound or need someone to come to them?
So actually, as part of our pre-registration process, when folks register now, that is something that they can check on the box to say, transportation is a restriction for them, so that we are able to collect that information now. Again, we'd be able to use that information once we can roll the platform out to be able to address that.
Great. And my second question, how will the rest of the tiers be opened up? So will you open up 1B, tiers 2 and 3 at the same time, or one at a time, and same with 1C with those tiers?
I think we're continuing to, again, explore the best way, the most equitable way, and more importantly, how to do that within the amount of doses that we have available. That's probably the biggest factor. It also is influenced by, how the state is moving forward. So, for example, right now, we are prioritizing based upon age, but all of the other sites within the county are open to everyone within the 1A, 1B, and 1C platform. So we are really trying to leverage and maximize the doses we receive to offer those to those who are vulnerable, and be kind of a safety net, if you will, to support, supplement, complement all of the other places that individuals can get vaccine throughout the county.
Great, thank you so much.
I think the one thing I would add to that is that obviously we are not, just so everyone's clear, in tier 2 and tier 3 of phase 1B, the essential workers, we're not going to leave you behind, even as we move into and start to think about 65 to 74 people as well. We're not going to leave you behind. It's just there's a lot of moving parts here, because number one, if the Johnson & Johnson vaccine comes on board, the state may have some different direction on to whom that is best applicable, because it's a slightly different vaccine. It's one dose. It's more focused on addressing significant illness and disease as opposed to some of the other characteristics of the Pfizer and Moderna vaccines where they might be better suited for other populations. And so as those come on board, we may be able to sort of have different targeted clinics within both the essential worker pools and the 65 and 74. I think the key thing is, and I think this is sort of what I said in the beginning comments, is we're going to be in this grouping for many weeks. And each week may look slightly different based on the type and allocation of vaccines that we get, but then we're going to be doing them both essentially concurrently, because I think the 65 to 74 particularly is critical to our equity process, because there's so many people who, because of health disparities, because of race, ethnicity, and other characteristics, the lifespan isn't getting them to 75. And so we want to really make sure that we're protecting in that population as well, for the reasons that we've talked about with equity, to ensure that the health outcomes that have prevented people from living longer lifespans don't also become the reason why they can't get the COVID-19 vaccine as quickly as possible.
Great, thank you.
Thank you. Kate, Ryan, WTOP, you had a follow-up question?
Thank you. Yeah, and a real quick one on school openings and cafeteria versus classroom eating. My understanding is that some cafeterias will be opened to as many as 50 plus students. Has the school system contacted you about that? Have you been working with them on those plans? And does that present a concern?
I think we continue to provide ongoing guidance, and we'll continue to follow up with them on those details. Again, I confess I don't know all the intimate details of the cafeterias that will be used, but we will be sure to follow up and make sure that in any of those spaces, whether it's cafeterias, gyms, or classrooms, that capacity limits are followed, as well as physical distancing and face covering requirements will be adhered to.
What is the capacity limit for a cafeteria at this point, or in schools?
Well, we've got capacity limits that we put forward for indoor and outdoor spaces. Again, I think we'll have to look at the particular spaces and recalibrate based upon the spaces there and the purposes for those places. And again, I don't know all the specifics of each individual plan that MCPS has, so I don't want to comment out of step and out of place. But everything that they have put forward in terms of their plans in our discussions has met the muster in terms of expectations for adhering to those respective guidelines.
Okay. But again, to be clear on the current guidelines for indoor gatherings, what are we at, 25?
We're actually at 10 for indoor and 25 for outdoor.
But to be clear, I think part of the executive order regulation. So, for example, the same things that govern indoor dining largely govern indoor food service establishments of all kinds, and so that would be a 25% indoor capacity that would be generally followed for those spaces where that's the. We do our executive order regulations largely based on the function or the activity, not necessarily the building in which that activity is occurring. So, for example, like if you were having a conference center banquet, it would follow largely the food service rules. If it were a gathering of some other kind, it would have to follow the gathering limits for a different reason.
Got it. Thank you.
Okay, that is pretty much the end of the questions from reporters, but
I did want to add, I know that there was a question in the chat. I don't believe it was from a reporter, but I did want to acknowledge someone asked about the limitations and restrictions on childcare facilities. We are actively looking at that and are developing a series of recommendations on how to move forward. So to whomever asked that question, it is being actively discussed, and we are engaged on that and hope to be able to put out some recommendations in the very near future. So please stay tuned.
Thank you, Dr. Gales. And I wanted to add another question that was one of the first comments on Facebook Live about mass backside in Montgomery County. And this particular county resident wanted to know how to advocate for the site, who should be contacted, and what should the message be. Anybody wants to answer that?
The governor.
The governor's office makes those determinations.
Yes. And the message should be, we're the largest county with the most cases. we need a mass vaccination site, but the doses should not come out of our existing supply, because if it comes out of our existing supply, nothing changes. It doesn't matter whether you get 4,500 doses that the county has from a mass vaccination site or from the county clinics. If that's all the doses they're going to provide, all it does is move around the location. We need them to provide additional doses to run the site, and we've got to be allowed to continue to finish the target populations like the 75-year-olds, because if they were to take doses from our allocation and use them in a mass vaccination site where it's anybody in groups 1A, B, and C, the 75-year-olds, the people who die the most from this, are going to continue to be left out there waiting for vaccines.
Thank you, Mr. County Executive. Thank you, Dr. Stoddard. Thank you, Dr. Gales. Thank you, members of the media, and thank you watching at home. We'll be back next week. Have a great and safe afternoon.
Thank
Good
you.
day.